Good evening to you all, and welcome to tonight's webinar, Staying Safe This Holiday Season, What Omicron Means for Adults and Children. I'm Madonna Hopkins, your host. I'm an anchor with ABC 7 News in DC, and I think you'll really enjoy tonight's event and discussion. We have three expert panelists who will squeeze a lot of vital information into this hour, and we hope that you'll step away feeling empowered and knowledgeable as we celebrate the holidays and gather with our family and friends. I think we're all experiencing some pandemic fatigue, especially with the nostalgia the holidays bring. Zoom, of course, is cool for business and for work, but it just does not cut it when it comes to family gatherings. So tonight we are hoping to educate you, to reduce the misinformation that's out there, and to alleviate some fear surrounding COVID so you can have a safe holiday season. Now, I report on COVID daily, and today we reported a grim milestone. Nearly 800,000 people in the U.S. have died of COVID in the past 2 years. And we know Black people have suffered tremendously and disproportionately with COVID. Since September of just last year, 1 in 1,000 Black people died of COVID. That is 3 times the rate of our white counterparts. One of the many things the pandemic has brought to the surface is the fact that Black people are hesitant to get the vaccine. And that fear is rooted in our history and experience with the medical field, whether it is J. Marion Sims, who became the father of gynecology by brutalizing and experimenting on enslaved women, or the Tuskegee syphilis study, or just general overall bias and prejudice in our modern day providers. So there is some progress, however, in overcoming that hesitancy. COVID vaccine clinical trials doubled the rate of Black participants than prior trials, but we are still asking people to take a leap of faith and get vaccinated. We know the Delta variant is prevalent right now, and health experts expect Omicron will soon take over. It has been found so far in 20 states plus DC. And while they await data about Omicron, they are pushing people to get the vaccine and also to get boosted. Experts say it is key to protecting people, slowing the transmission of COVID, and reducing the likelihood of new variants, as well as preventing serious illness and death. Right now, about 467,000 or 67.5% of people in Washington, D.C. are fully vaccinated. In Maryland, about 4.2 million or 69.3% are fully vaccinated. And those numbers in Virginia are 13.8 million or 66.8%. And you might be saying, well, that's more than half. That's a majority. What more do you want? Remember, though, herd immunity is at least 80%. And the virus is still spreading because it continues to find hosts. Now, people as young as 5 can get the vaccine now, but health officials are, of course, asking people to take their kids to get the vaccine against COVID. This is important, though, especially as we face a possible winter surge. We know that cold drives people indoors, and some might be getting kind of lax with their mask wearing and their hand washing. So tonight, we want to arm you with the information that you need to stay safe, and also information you can share with your family and your friends as we all gather this holiday season. I want to ask our panelists now to introduce them to yourselves. This is an amazing bunch of experts, and they're providing some vital information for you tonight. We'll start with Dr. Diana Abney, followed by Heather Burris, and then Aisha Gray.
Hi, good evening. I'm Diana Abney. I am the health officer for Charles County Department of Health, and I am a pediatrician.
Hi. Hello, good evening, everyone. Thank you so much for having us here. My name is Heather Burris. I'm the Immunization Division Chief at DC Health.
Hi, good evening. My name is Aisha Gray. I am the Chief Operating Officer at CareFirst Community Health Plan, District of Columbia. That is always a mouthful, but my background is in public health and population health management. So also very happy to be here with you all this evening.
And it's a pleasure having you all. Thank you for sharing your time tonight and your expertise and perspective. You know, I want to first ask you all just current events, your take, and what do you want people to know about this Omicron variant? Dr. Abney, I'll start with you.
Okay, well, the first thing I want you to know is that it appears that even though it's very contagious, it doesn't appear to be as deadly as some of the others, which is a good thing. It also appears that the vaccines that we have are working well against this particular variant.
Heather, I want to ask you, I feel like when I'm out in the community talking with people, when they hear things like this variant isn't as deadly or as severe, some people have the reaction of, well, I don't need the vaccine then. What is your response to that?
That's absolutely not not true. I think as many people as possibly can get the vaccine should get the vaccine. As you stated already, herd immunity is 80%, and we are falling short of that. Not too far short, but we're getting there. And so there's more work to do. And I think one thing that I would like to say that I always am reminded of is, consider the impact that we've already experienced, as you've already done in your introduction, on our communities, and remember, your neighbor, your grandparent, your school teacher, others that look like you who have been impacted by COVID. And then remember to do your part. If you are eligible for the vaccine, consider not just your own risk and benefit, but those of others around you, and get vaccinated.
Mm-hmm. Aisha, is there one vaccine that you would recommend over another vaccine, especially when it comes to effectiveness against Omicron variant?
No, I think we have seen research and data has borne out that all of the vaccines that are available to the public at present are effective in preventing serious hospitalization and or death. So whichever vaccine is available to you in your communities, we are aware that different pharmacies, for example, will have stock of different types of the different brands of the vaccination. Again, all of these vaccines have been proven to be effective against the spread and preventing severe illness and or hospitalization. And when we're thinking, Adriana, to your point about this new variant, we've already seen that COVID, as viruses do, mutates very quickly. This virus is very smart, and existing vaccines should still protect people who contract the Omicron variant from severe COVID cases. Again, we have highly effective vaccines that have proved to be effective against all of the variants so far in terms of severe disease and hospitalization, and there's no reason to expect that it wouldn't be so for Omicron.
I want to ask you, Aisha, why is it that we get a new variant of COVID? Why is there new alarm? I mean, we've had so many mutations of this. We've had Alpha, Lambda, Mu, Delta, now Omicron. Why is, the trendy thing Omicron at this point?
Sure. Well, I think, again, it's that speaks to the point of how quickly the virus mutates. And again, this is not unique to COVID. This is part of viral behavior. And again, I think Dr. Abney spoke on this, but the reason that we want to make sure that our communities are armed against Omicron is because we are seeing in the early data that Omicron is more transmissible than the other variants, the Delta, Mu, et cetera. And it will likely become the predominant variant in most places. Mm-hmm. But again, early reports seem to indicate that the Omicron variant is much more contagious. So it will be spread easier from person to person, but causes milder disease. And so I think that's a really important takeaway from this conversation. And as we are all going out into our communities and talking to one another about this, the thing to keep in mind about Omicron, while it is more contagious, it's less dangerous. And so, again, we need to continue to take all of the precautions that we have been doing for the past 2 years since we have been in this pandemic environment. But again, making sure that we're masking, washing our hands, and social distancing as much as possible.
It all kind of goes hand in hand. Go ahead, Dr. Abney.
So it is important that we pay attention to new variants, but right now in the United States, 98 to 99% of the COVID is Delta. And we know that Delta is susceptible to the vaccines that we have. So the first line of defense for us is indeed getting vaccinated and getting up to that herd immunity. And then, as Aisha says, then we have to make sure that we're still doing the 3 W's: washing your hands, watching your distances, and wearing your masks.
It's interesting, when we had that soap shortage when the pandemic first began, that really signaled to me that people were not washing their hands the way they should be. Dr. Abney, I want to stick with you, and I want to talk to you about, we are saying a lot about our community. I want to talk to you about Black people and the response that you're getting from Black people when you tell them your message of our first line of defense is getting vaccinated. I've had conversations with people, family included, about the vaccine. They tell me it's new. You don't know anything about it. You don't know what it will do. I say it's been researched. And frankly, if we're all to turn into mutants, then we'll all be mutants together. But what is it that you're hearing from your community, the people that you come in contact with, and your patients?
So you're hearing a couple of things, and it's gotten better. Let me say it's gotten better with time. But some of the things that I would hear are exactly what you said. Well, this is new, and I don't want to be a guinea pig. They're experimenting on us. And this is not just in the Black and Brown community that I was hearing that particular thing. Or another very common one was, I just want to wait and see what happens. I want to let some other people get it first and make sure they're okay. But unfortunately, the risk there is that you could potentially get COVID and not be okay because of having contracted the disease. Or even if you're okay, you could have potentially spread it to a loved one or a work colleague. It helps very much, I think, in our community or any community when they're hearing from a trusted person. So it helps when you hear from people who look like you, people who live in your community. For me, I've been in this community in Charles County for almost 30 years as a pediatrician. So hopefully that helps people pay attention when I say it, or when some of my colleagues who are physicians in the county say it. But those are the things you hear. Sometimes you also hear the things that are those internet and Facebook rumors, like they're putting a tracker in you. The hole in a needle is so tiny, no tracker is going through there. Or that we're magnetizing people's arms. But those have already been debunked. I mean, if you did believe in them, they've definitely been debunked. The biggest ones are, it's too new. And the answer to that, of course, is mRNA technology has been around for decades. And then they also say, well, you made this vaccine so fast. The reason this vaccine was made so fast is not only that the technology was already being worked on, but because it was a pandemic, because people all over the world were affected, the funders opened their purses very quickly. And the people who might not have been natural collaborators, because they were usually going against each other to see who could patent something first, were working together because they were trying to save lives. So as a result, it was a lot easier to get research done quicker because of both funding and collaboration.
You mentioned the conspiracy theories, and I joke a lot with my friends that I got boosted and they recharged my microchip and I'm boosted up to 6G at this point. But it's all in good fun. I think you have to kind of make fun of the conspiracy theories because this is a very serious time. Heather, I want to ask you, we talked about Washington, D.C.'s vaccination rate, and it's above the national average, and, it's nearing 70%. How hard has it been to get out there and get the community, to rally them to get the vaccine?
Yeah, it's been really challenging, I would say, in a couple of populations, specifically around our 18 to 49-year-olds across the board, but even more specifically in our communities of color, east of the river, Ward 7 and 8 have the lowest vaccination rates. And then what's especially concerning to me as a parent is that those 18 to 49-year-olds are the parents of this newly eligible age group, the 5 to 11-year-olds. So if your parents aren't getting vaccinated, what's the likelihood that you're going to take your child to get vaccinated? And that's so critical because I think that children often are the vectors in our community, right? So a lot of times that they might carry that bug and they'll be okay, but then they're passing it on to grandma and they're passing it on to their school teachers and their friends. And I don't know about you, but I have a 5-year-old and an 8-year-old at home, and they bring home germs all the time. And so it's really important that we focus on these communities, we focus on these target populations, these 18 to 49-year-olds, but then especially those residents in that age group who live east of the river. We actually did a pretty decent job. I'm pleased with the response by our Black and Brown seniors in the district. They really, understood the assignment, as they say, to know what the risks are for their population and for their age group. And they got vaccinated, and their numbers are high pretty much across the district. But we still have some work to do east of the river in our young adult population, and with them being parents, our children.
I mean, kids are the absolute germiest. I have a 2-year-old and a 6-month-old. My 2-year-old brought home some germs. My 6-month-old got it. My mom was in town. She got it. I mean, it's just, that's what they do, is pass it along. What would you say about access? Has that been a problem in Ward 7 and 8, access to getting the vaccine, or is it more just people are hesitant to get it?
People are hesitant. We were very intentional with our equity strategies and making sure that we stood up locations in Ward 7 and 8 that had vaccine, but also proactively stood up pop-up clinics in those locations, school-located pop-up clinics, rec center pop-up clinics, and then we have a robust network of providers in Ward 7 and 8 that are federally qualified health centers, pediatricians' offices, and I personally made sure that they all had vaccine because those are the populations that I work with the most.
Aisha, can you comment about the messaging that's gone out about the vaccine and how it's been received?
Sure. And I would just echo again what we have seen at CareFirst is less of an access issue and more of a hesitancy issue for many of the reasons that have already been discussed. And we also see statistically that, the adoption of the vaccination rates are lower in Wards 7 and 8, and more specifically within the Medicaid population across the district. So in terms of messaging, we have also tried to be very intentional about creating partnerships in the communities with trusted community partners, with our primary care physicians that are in network. Also hosted a series of town hall events like this one to provide information about the vaccination. We also have a nurse line and our case management model. And we also have a wellness navigator model, which also follows our enrollees throughout their continuum of healthcare needs, again, to just reiterate the importance of the vaccine, to make sure that our enrollees are aware of how to access the vaccination, and again, really to, I just can't overemphasize the importance of receiving and delivering the message from people that are trusted in the community. We have seen in the DMV area, in particular, as we have across the country, that there is also a very effective misinformation campaign at play to deliberately misinform communities about the vaccine. So I think, we have to stay vigilant about getting the message out there and being good models for our loved ones and the members in our community.
You mentioned a very effective misinformation campaign, and that's so true. I hear all the time people saying, I saw on Facebook, or I heard on, Instagram, or Nicki Minaj tweeted her mess about her cousin's friend, etc. People have brought up breakthrough cases, and I think that some people who are hesitant about the vaccine really jump on this point about people who have been vaccinated and they get COVID. We know here in DC and Virginia, the couple of Omicron cases that they have found, those people have been fully vaccinated. But what would you all express to people about these breakthrough cases and still the necessity of being vaccinated? Dr. Abney, I'll have you start.
So the first thing I would say is the number of people who have breakthrough cases is very small compared to the number of people who get COVID-19 who have not been vaccinated. So I'm going to repeat that. The number of people who have been vaccinated and get COVID-19 is very small when you compare it to the number of people who've been vaccinated. The other thing that's very important, and I think one of my colleagues mentioned this a little while ago, is that the people who have been vaccinated are less likely to have severe illness. They are less likely to be hospitalized. They are less likely to be placed in the ICU, put on a ventilator, and they are less likely to die. So those are the things that people need to keep in mind when they're hearing what the other people are saying, all of the misinformation that's going on. They need to keep in mind that nothing is 100% first and foremost, but these vaccines are very effective. And their main purpose, in addition to helping prevent the disease, is to prevent the severe illness and bad outcomes, which they're doing a very good job of doing.
And I think people take for granted they might be young and healthy. And Heather, you mentioned that, 18 to 49 is the age range that's really hesitant because you assume, they're young, they're healthy, and they take for granted that if they get COVID, they won't be on a ventilator in the hospital and in a medically induced coma for days on end. But you really can't tell how COVID is going to affect you until you get it. We're talking more and more about these treatment pills. Pfizer has one, Merck has one. Are you all finding that people are using this also as a reason to not get vaccinated now that we have kind of the Tamiflu version of a COVID treatment pill? Aisha, you're shaking your head.
Yes, we are starting to see that kind of false reasoning. And what I will say about the antibody pill is that, again, getting vaccinated remains the best way to protect yourself, your family, and your community against COVID. These antiviral antibody pills are a form of treatment after you get sick with COVID. So the pills don't keep you from getting COVID in the first place. So again, the best protection is to get vaccinated and employ the 3 M's.
Heather, I would like your take on that as well from, people in DC. Are you hearing that this treatment pill is now getting some trend here over the vaccine?
That's what I've been hearing on the front lines. At DC Health, we actually separate those. And our therapeutics team has expressed that has become a high demand. I know we get a lot of inquiries for it. And so I am starting to see that more often. But I would echo what has already, been said, and especially with regard to like breakthrough cases. It's like, trying to fix something that has already gotten out the door, essentially. And we all know that our best method really is prevention. For those who are experiencing breakthrough, like she said, it's not 100%. And honestly, it was never advertised as such. Even the early data of Pfizer was like in the 90s or something percent. So we knew that we were going to see breakthrough cases. That was an expected outcome. But the great thing is that in DC, it's remained less than 2% of those amongst fully vaccinated. So we're in a really good place where the vaccines are working as described and as they should.
I hear people talk a lot about natural immunity. In fact, going back to that misinformation campaign, there's a whole clip on social media right now of a woman at a school board meeting singing her whole natural immunity anti-vaccine song to Mariah Carey's All I Want for Christmas. And, people laugh and make fun of it, but she very clearly believes this. And I understand that people believe having had COVID before gives them some sort of natural immunity or boost to COVID now, regardless of the variant. Dr. Abney, I'd like to get your take as a healthcare professional. What do you want people to know about natural immunity and coronavirus?
So natural immunity does exist. That is a true statement. But natural immunity also wanes. And COVID is new. We don't know how quickly that natural immunity is going to wane or how far down it's going to go. So we can boost that natural immunity by getting our COVID vaccines, getting our primary series of 2 if it's Pfizer or Moderna, or 1 if it's Johnson. And then if it's time for the booster, 6 months for Moderna or Pfizer, getting your booster, or 2 months for your Johnson, getting your booster. Sometimes people refer to that as super immunity, but basically it boosts that immunity back up to a higher point so that you're better able to fight it off. I mean, if you think about it, when your children get vaccinations, they get them at 2 months, 4 months, 6 months. And then when they're 4 years of age, they get a DTP and polio booster. They get a measles, mumps, rubella, and varicella or chickenpox vaccine younger. And when they are 4, they get a booster. And our children get an 11 to 12-year-old DTaP. Same reason. We're boosting immunity that was there. So we know that these things can wane, whether they're natural immunity or immunity that we give. So boosters are important to making sure that we stay protected.
I'm going to keep you on the line here and ask you, based on the early data that you're seeing, and I say early because, like you said, we don't know a whole lot about coronavirus at this point, and people are slow to take the vaccine and get us to herd immunity. Can you foresee whether we'll need a booster shot yearly, kind of like the flu shot?
So it's very likely that we'll need a booster shot, whether it's yearly or whether it's every couple of years or what's going to happen, we don't know. But it is very likely that COVID will be with us for a very long time.
Did we just miss the window of nipping it in the bud and getting everyone vaccinated early?
That's a hard thing to know because of the fact that viruses, as one of my colleagues says, this is what they do. They mutate. And it's survival of the fittest, right? They mutate. So we don't really know. We're learning about it every day. But it is very possible that we're going to have it around for a while and that we're going to need boosters, if you will, in the future.
And if I would add to that, the flu shot every year is a combination of some strains, that have been seen in previous years. And so it would not be not to my surprise if we started to incorporate some of the COVID vaccine and the flu into I'm sure some company is already dreaming this up.
Oh, yes.
That you would already have, double immunity, I guess, and in that next vaccine type so that, you do only have to get 1 shot. And that happens often in pediatric vaccines, routine vaccines. They combine antigens. And so you're getting 1 shot and protection against multiple vaccine preventable diseases.
Let's shift our focus to talking about kids and, K through 12 and people taking their kids to get the COVID vaccine. One of the arguments that I always have with people is, you get your kids vaccinated for a wide variety of things already. And in order for them to go to most schools public for sure, and some private schools and charter schools, you have to show proof of vaccination. Why is it that parents seem to be hesitant about getting, their 5-year-old or 10-year-old or 14, 15-year-old vaccinated with the COVID vaccine? Aisha, I'll have you start.
Well, I will defer to my colleagues on a more science-based answer to this, but, and I don't mean to be glib about this at all, but, what we are seeing across the country now in a way that we have not historically, with respect to vaccination, is that, COVID has been politicized. And so it's very difficult to shift someone's core beliefs about something. And, I think we have really done, our larger community, across the country a disservice by making this a political issue when it's really a public health issue.
Absolutely. Dr. Abney, what's your take? I mean, you brought up chickenpox, and I feel like I got the chickenpox as a child. I now have shingles lurking in my system waiting to pounce. But I think that it's lost on this generation.
For that.
And I will get it. I guarantee you that much. But I think it's lost in this generation that they don't even know what chickenpox are because they got the vaccine.
So you're right. There is some of this. Well, we did a very good job with vaccines, so people don't understand that these illnesses, which became very minor childhood illnesses, used to cause a lot of problems, and in some countries still cause a lot of illness and, in fact, deaths.
Yes.
So we did a really good job. Public health did a great job with that, and people got complacent. That's one of the things. And as Aisha says, it's politicized, and not just in the United States, but all over. And then it's just also that in the past, we did not have Facebook and Twitter and TikTok, where these rumors and these odd things that people are saying are just blasted all over the place.
Yeah, that's a virus within itself.
That's true.
It is exactly a virus within itself. And unfortunately, we have a culture now that wants to believe those people as opposed to believing experts. You've got a better chance of convincing somebody of something if you're a star or an influencer than if you're one of us sitting here on this particular panel. Unfortunately.
Yeah, there's a lot of unqualified people out there pretending to be credible, and people are buying into it. Heather, I want to ask you, what you're hearing from community members in terms of why they're not getting their children vaccinated from COVID, but chickenpox, MMR, polio, no problem.
Yeah, I know it's really frustrating. I know a lot of individuals who are well off, affluent, educated, and they're choosing to wait, as we said earlier, because I'm not subjecting my child to that. And it's like, you're subjecting your child to medications, to other routine vaccines, to the things that they eat, So as parents, like, there's a lot of hard choices that we have to make. There's a lot of things that we have to worry about. We don't know the long-term effects of COVID disease in children, right. So at this point, like, if your kid is getting vaccinated for school to be in person, if you're paying attention to the data and it shows that the vaccine was well tolerated at a reduced dose, they provided a robust response. Like, I'm not really sure, what else, what other reasons you can give. I have two friends, one who is in the medical community, one who is a pharmacist who had children in the trials. And so that was really encouraging to me because my background actually is in clinical research before coming into DC Health. And so I've always been a supporter of clinical research, and especially having, folks that look like us represented. And so to see them actually put their children in the trial, gave me a boost of confidence. And I already supported research, but gave me a boost of confidence when I see, our kids play together. One of the moms, our kids were actually in the same class. And so that was encouraging. Plus the fact that 24 million doses have already been given in children 5 to 11 years old. So it's one less thing really that you have to worry about, especially if you experienced and survived the last year of virtual learning online.
Right.
I don't want to go back there.
I know that's right.
I truly enjoy in-person learning because God did not gift me to also be a teacher amongst all the other things I'm doing in my daily life. So, having kids who are fully vaccinated, and mine are, one less thing to worry about is quarantine.
Right. Absolutely. It's funny you mentioned your friends putting their kids in the trial, because I also have a friend who put her 4-year-old and 2-year-old daughters in that trial. And her reasoning was, I hope they're getting the vaccine and not the placebo, because she had family members who died of COVID and family members who didn't seem to have any comorbidities or any other underlying issues. And so she was saying, please give them the actual vaccine. I want them to get it. I do know when I did the report on her, I did it for ABC7 here in DC, and there was a lot of commentary, and I wanted to turn the comments off because people did say she's putting her kids up for guinea pigs and call CPS, and people were concerned that because they were little girls, maybe the long-term effects would affect their reproductive system. And again, Dr. Abney, I think it plays to this massive misinformation campaign from non-scientists who don't know the data, who wouldn't know how to read the data. But what would you tell people about the long-term effects of the COVID vaccine in children versus the long-term effects of COVID in children?
Very good question. So the first thing is, most of the things that people say that COVID can do, we have to understand that it doesn't get in your DNA. Yes. It doesn't change your cells. Basically, the messenger RNA, which is what mRNA stands for, and we have messenger RNA in our bodies all the time. What it does is it sends some information to your body and says, hey, this is how you make the antibody, the thing that will help you fight off this COVID if it comes to your body. It doesn't go in and do anything else. It doesn't change other things in your body. So that's the most important thing to know, to understand how it works. The long-term effects of COVID, especially if you get severe COVID, of course, the most severe case is you're not with us anymore. That's the biggest long-term effect. But if you've had to be in the hospital for a long time, if you've had to be on a ventilator, there are long-term effects associated with that. Scarring of your lungs, problems with your heart, all of these kinds of things that as parents and as physicians and other medical care people, we don't want your child to have to deal with. And when you look at, again, looking at the data, millions of people have gotten vaccinated. They are not running around with the same problems that you see when you look at the number of people who have gotten COVID. The number of people who have died from COVID is just outrageous and to a great degree unnecessary, because we've had vaccinations for long enough that some of those people, actually we're over a year now for having vaccinations.
As of today, it's December 14th.
Oh, right. Then
first distribution started today.
So there are so many people who have suffered who don't have to suffer or didn't have to suffer. So I just say, the long-term effects of COVID illness are clearly worse than any that you might think of and any that someone might tell you erroneously are there with COVID vaccination itself.
I've done a lot of stories of people who've had COVID. There's one guy that comes to mind. He was 32 years old. He had done Ironmans and marathons and worked out, did 2-a-days, and he got coronavirus, the flu, rhinovirus, I believe, and he was in a ventilator at Johns Hopkins, and it just totally wrecked him for about 30 days. And one thing people don't bring up, and Aisha, I'd like to hear your take on this, if you hear anybody say any of this to you, the financial burden that COVID can bring. We know for a long time the government was picking up a lot of the bills for coronavirus. That ended. And now you're getting those bills. Aisha, do you have any comment on the financial burden of getting coronavirus versus the free COVID vaccine?
Well, Adriana, I think you just summed it up perfectly. So the COVID vaccine is free. And, we, through like policy making and legislation, have made it so as part of, just making the vaccination accessible to all people wherever they are. Mm-hmm. And to your point, when you talk about the costs of long-term hospitalizations, specialty treatment and interventions, depending on the length of illness or hospitalization or necessary treatments to manage the not only the virus, but the co-occurring conditions or symptoms, that can be tens of thousands of dollars, if not more. So I just, again, I think this is why conversations like these are so important in making sure that we are getting the most accurate information out there so that people are informed and are able to make good choices based on, a full complement of information.
Mm-hmm. And real information based on scientific data.
Yes, absolutely.
And not your latest TikTok that people are watching. We talk a lot about, getting boosted right now. President Biden is saying if you have the vaccine, if you're fully vaccinated, go ahead and get boosted. In fact, Dr. Anthony Fauci is saying that he foresees in the future being fully vaccinated will be having those 3 shots, the 2 initial as well as the booster. That being said, children as young as 5 can get the vaccine. Do you foresee them having to get the booster more regularly than adults? Because their immune systems are different. So, right now it's 6 months out for adults, possibly a year from now. Will it be every 6 months or so for kids, or is it just too early to tell? And Dr. Abney, I see you leaning in, ready to answer.
So one of the good things is children's immune systems are actually very good, and they make a very good immune response. So I would probably expect that they would get the boosters at about the same cadence that we get the boosters, as opposed to earlier. If anything, they might have a chance to get it a little further out as opposed to earlier than we do, because they get their vaccines and their immune system just responds better. People used to talk about, well, why did you start giving HPV to people so young? And part of it is because their immune system works better. In fact, if you're under 15, when you start that series, you only have to get 2. If you're over 15, you have to get 3 because of how much better your one of the reasons is how much better your immune system works.
Oh, that's interesting. So, as I mentioned, one of my friends enrolled her daughter in that vaccine trial at Children's National Hospital here in DC. And in talking to the principal investigator of that trial, he said that he does believe children as young as 6 months will soon be eligible for the vaccine. So, Dr. Abney, there are people who are hesitant about their 5-year-olds, 11-year-olds, 12 and 17-year-olds. How do you think people will react to getting their 6-month-old vaccinated against coronavirus?
So I think there'll be a little bit of a mixed bag. There will be those who will be worried about it, just like there are for the people who, when we first started giving it to our seniors and our healthcare providers, were worried. But I think we'll have a couple of things in our favor for our 6 months to 4 years of age. One, we'll have more history. So I just want to wait and see, little less of a good reason to say that.
Mm-hmm.
And the other thing is people who have children in that age group are used to their children getting vaccinations.
Yeah.
Those that get their vaccinations for their children understand the need for their vaccinations. So I expect, and I certainly hope, that there'll be not a worse uptake, but a better uptake than there was for older people. We saw a very robust uptake for our 5 to 11-year-olds here in our county. And I think most people saw that. And they also probably saw a much better robust uptake in the beginning for their 12 to 17-year-olds. So it looks like it's getting easier for people to say, okay, I can do this now because I've seen it. People are doing okay.
Yeah.
And unfortunately, we know that people who are not getting vaccinated are still dying. And we also know, unfortunately, that little children do get COVID, and little children get very sick.
Yes.
Little children die from COVID, and little children, just like adults and older children, can have long-lasting effects from COVID.
And, you mentioned so many good points there. I've done stories on kids who have that MIS-C that develops, that inflammatory disease that it develops with coronavirus. And again, that's something, I talked to a mother and she was devastated because her daughter had a mild case. And the next thing you know, she's in the hospital at Johns Hopkins and there's coronavirus protocol. So she can't really even be there with her daughter who's hooked up to all kinds of machines. So really all the way around, it can be very devastating financially, mentally, and emotionally to get COVID versus getting the vaccine and not really having to deal with a whole lot. Even if you get a breakthrough case, it would be mild. I also want to ask you all, and Heather, maybe you can kind of touch on this, vaccine mandates. You mentioned that the vaccine has been very politicized, and it absolutely has. And Aisha, you said the same thing. But do you find that the vaccine mandates are working, or do you find that it's giving people some reason to be contrary?
I think it depends on where you live and the industry in which you work. I can say honestly, I review our data that goes on the DC Health dashboard weekly, and we have seen an uptick in demand. And we think it's because there's a lot of workplace mandates, either issued by our mayor for district employees, in schools, and now private workplaces, are doing that as well when they have a certain amount of employees. And so we see that coming out in terms of demand. Our daily or weekly administration rate has doubled and tripled over the past month as people are getting ready for these in-person activities beginning in January. So yeah, it is working, and it is one mitigation strategy that many jurisdictions have taken.
Aisha, I want to ask you, about mandates, but the mask mandates. New York just passed a mask mandate for those areas that don't require proof of vaccination to be indoors. Are you finding people having mask fatigue and just being against them no matter what? Or do you think that people just kind of fall in line?
And I don't mean to, softball this answer, but I think there's a mix of both. We are seeing people that do, have mask fatigue and they're just over it, which, I certainly understand. I feel the same way. But, I also understand how important wearing a mask is and, and like helping to slow spread and, not only to protect myself, but to protect people that I come in contact with. So again, I've seen a mix of both. But what I will say with respect to mandates and to Heather's point, I think it's very dependent upon industry. But CareFirst, our president and CEO Brian Pinnock, implemented a vaccine mandate for all of CareFirst's employees as of this past November 1st. And I think, again, when, like my colleagues on this call, as, healthcare professionals, I think it's very important, that we model the behavior that we are trying to encourage in the community. So, I think, and that just goes back to, trusted community partners, how important those models and those messages are.
Dr. Abney, as a pediatrician, I want to ask you your advice for parents to protect their kids in schools, as some schools are loosening their quarantine guidelines as well as their mask mandates. What would you tell parents to tell their kids and to really push for protection from COVID?
So the first thing is, if their children are old enough to be vaccinated, get them vaccinated and be vaccinated themselves. For those who are not old enough to be vaccinated, make sure the rest of the family is vaccinated to put a cocoon around those children to help decrease their exposure. And even if the school says that you don't have to wear a mask, empower your children to wear masks.
Okay.
There is nothing that says because you don't have to wear a mask that you can't wear a mask. So, and little kids, I find little kids actually many of them enjoy it. I've had little kids in my office, literally, who, if their mom is walking out the door with them and they don't put that mask back on the child is having a little hissy because they're like, wait, I'm supposed to have my mask on. They're more likely to notice. Exactly, right? So empower them to realize that if they want to have their mask on, and if you've taught them that they're supposed to wear it, that it's okay to wear it, just like you tell them about other things. You don't have to fall to peer pressure because this is protecting you. And oh, by the way, it's also protecting the people around you. And I think that's a really big thing, is empowering your kids to take up for themselves and speak up for themselves. And even 5-year-olds can do that.
Yeah,
Absolutely.
if I can just jump in on that, my son will get out the car and, Mommy, I don't have my mask. And he wait to me go back and get his mask in the car. But one thing that we did in our school community, in collaboration with some other parents, because I'm that parent who's posting where you can get the shots, and in our Parent Square application, we started a thing where we're asking families to share, I got the shot because, and then put some pictures up with their kids. And so my 5-year-old, he said, I want to protect my community. I was just typing away his little message. I want to protect my friends. I want to protect my teachers. I don't want to get the COVID. I don't want to get, so they understand what's going on, and they know the importance of this. And like Dr. Abney said, if you and your family instilled some personal responsibility in them, and they understand, that they are players in the community and protecting one another, and respect for themselves, respect for their environment, respect for their families, they will. It's easy. It's like a no-brainer to them, So I totally agree. Encouraging primary vaccination, secondary, making good choices.
Let's talk about gathering for the holidays. Christmas, Kwanzaa, New Year's Eve, all upon us. And we've been a couple of years now under strict guidelines of not gathering, especially if there's older people around. So let's talk about how to stay safe as you're gathering with family. And Heather, I'll have you continue your advice for people as they get together with grandma and granddad and young cousins and babies and people they haven't seen all year.
Yeah, get vaccinated if you haven't already. It's never too late. There's still plenty of supply in the community, so that's not an issue. Access is rampant, so get vaccinated, get boosted if you are fully vaccinated. At this point, you can get any vaccine as your booster. CDC has said that is okay. So there's no limitation. You got Pfizer, or I want to get Moderna, get what you want. Get a booster shot. And then My other thing would be, if you're traveling, get tested. Get tested before you go, especially if you know you're going to be around somebody who might be more susceptible than you, just because by their age, or maybe by their environment, or maybe if they have small kids at home. Testing is so convenient now, and it's a great tool, I think, to arm with you. And then, practice all the things we already said, making sure you're washing your hands, absolutely making sure you're wearing your mask. And then just really kind of, watch your surroundings, know how far you are apart from somebody that you may not know, that might not be in your immediate bubble, and just kind of take notice of those things.
Yeah. Now, Dr. Abney, I do want to ask you about your thoughts on gathering with family as well. I, for instance, have family coming to see us for Christmas. I know that we're all vaccinated. Those of us who can be, we do have young children who aren't qualified yet. How lax can we be with social distancing and mask wearing? I mean, should we take comfort in the fact that we're all boosted, or should we still have some caution there?
I think it's a healthy thing to still have some caution, because we know that some of the people may not have had their 2 weeks between their vaccination and today, or Christmas Day, because they're like, oh, I better go get it. And they got it 2 days ago.
Yeah.
So they're not fully vaccinated. And then we all have people in our homes who are a little more susceptible than others. So that's a possibility. So there's some things that you can do. Try to limit the amount of time that people are very close to each other. As Heather said, spread out a little bit in the house. If it's a warm day, open the windows a little bit. We can put on a sweater and have the window open. You can put a quilt on grandma's lap and those kind of things, because that fresh air blowing through decreases the buildup of things, germs and things in the room, right? And if it's really a nice day, eat outside. It can happen. And remember, though, everybody's not going to be here in DC metropolitan area. Some people are going to go, who are listening to us, are going to go to their families in New Orleans or Florida or Arizona, where it may not be cold. So for them to hear this is important also. But then also washing your hands, keeping your hands to yourself, trying not to touch your face and your mouth, covering your cough. Even if you're vaccinated, even if you're comfortable enough not to wear a mask, cough in your wing, not in your hand, so you're not touching people. And if you're going to serve your food where, everybody wants to have mama's best dressing or somebody else's sweet potato, have one person do the serving so that multiple people are not breathing over the food, and you're not standing there in front of the server for a long time while you're saying, but give me have one person serve. All of those kind of little things will make a difference.
Yeah. I've said, and I've joked all through the pandemic, I don't mind some of the new regulations that people have put in place, the hand sanitizing, hand washing, one server. I like that idea.
Not blowing out the birthday candles.
Oh, God. Yeah, that should never have happened to begin with.
Now that I think about it. I've taken one of my birthday cards and fanned out the fan.
Yes. My mom's a doctor. She does the same thing. People thought it was weird, but I'm like, we don't want those particles on your piece of cake. Aisha, we are running out of time, but I want you to briefly talk about CareFirst and its community immunity series.
Sure. Okay. So, oh my gosh, I also have, serious time blindness from, being in the house for 2 years. But it was February of this year, 2021, that CareFirst launched community immunity town hall events, which is really a series of events similar to this one to address communities that are disproportionately impacted by the COVID-19 pandemic. In developing this series, we were intentional about needing to address the impact of the pandemic, but also to provide a forum to, again, provide accurate and credible information from people, from scientists, that people work in the healthcare community. Nicki Minaj is lovely, but you don't want to get your, healthcare advice from her. and then, you know, really wanting to leverage these trusted voices and partnerships to like amplify our partners in the community who are working on the front lines of the response. And, you know, we will likely continue to do these because again, reiterating and repetition of a message is really critical to the adoption of it. So again, we are just really honored to be part of this and specifically this discussion tonight.
Wonderful. Well, thank you, ladies, so much for your time, for sharing your expertise, for not billing our insurance and making us pay a copay. Thank you for giving this to us for free. It's certainly appreciated. You ladies have a wonderful rest of your night. And for all of you who are watching, be sure to visit carefirst.com and click Learn More for COVID-19 information and resources. And be sure to continue getting your information from trusted resources and people who do have a background in science, research, and data. Thank you all for joining us tonight. You take care.